Hi, my name is Mary Ann Guza, and today, I'm a nurse here at the DermDox Dermatology Center with Dr. Steven Schleicher, and today we're going to perform a microdermabrasion. Our patient here, Magdalena, she's had these done before, so I think she's eager to get started, though, with another procedure today. As I'm going along, I'll demonstrate what the microdermabrasion is all about and what it's to do for the skin. And if anyone would have any questions, they can call here or ask me later. But I guess we're all ready to start. How are you, Maggie? Ready to go? Mm-hmm. All right. So first of all, we're going to, as you see, I have a drape on the patient, and we're going to do the same thing here. Protect her hair. We got a band here for her hair. Okay. This is the machine that we use. It's called a Belloderma Microderm machine. It's one of the state-of-the-art models. We've used this for a little while now, and it does a very good job. It has some adjustments on here that we could adjust it to the patient's skin. If they're a fair skin type, of course, we'd have it on the lower settings. Since Magdalena has had these treatments before, she likes a more aggressive treatment, so we're going to get that up almost to the highest tier of the machine that it can go, which is like a number 5. And that just regulates the pressure and all of that of the machine and emits, it helps us to emit the aluminum oxide crystals, which is the ingredient that we use here to do the microdermabrasion. So I'm just going to grab a pair of gloves here and get started. As I said, we've done these before, and we have a lot of patients asking us questions about what does the microdermabrasion do, why should I get one of these done, what exactly are they for. They're for fine lines and wrinkles, they're for acne, they're for hyperpigmentation of the skin. It's used for a lot of different reasons, and it just gives the skin a nice perk. If someone's going somewhere and they want to kind of refreshen their skin, it's a nice facial type treatment. Okay, so we start with, first of all, cleansing the skin, just gently cleansing. And I don't think Magdalena has a lot of facial makeup on here. Mm-hmm. So we're almost just about ready to go. Again, it's good to do it on Magdalena because she's had these done before, so she knows what to expect, and she knows what I expect when she comes in. Our next step is we apply a facial mask. This one is a deep pore refining mineral mask, which helps to prepare the skin for the microderm treatment. What this does is it takes care of a lot of the excess oils, and it's just like painting a picture. You get the canvas ready first, and this is what we're doing to Magdalena's skin. Again, Maggie sometimes gets a little bit of acne breakouts, which is why she likes to have these done. It keeps her skin very nice. Turn this on. As I said, we have this on a higher setting, and we just basically, I like to start here at the forehead. Taunt the skin. How does that feel? Is that all right? Mm-hmm. All right. Right here, you go into the area where there's any fine lines and wrinkles, crow's feet, things like that. Generally, we recommend a series of 3 treatments, and they can be done safely every 2 weeks. And then after that, if the patient requires or the client requires some more treatment, we can add 3 more treatments, same thing every 2 weeks, until we get to a series of 6 treatments. At that time, we generally ask the patient how they feel, and if they'd want to continue, well, then we wait for a little period of time before they get what they call maintenance treatments. Usually when you start getting these done, you pretty much know when you'd like to have another one. Isn't that right? Mm-hmm. Okay. You can tell by how your skin feels once you get started with these. Mm-hmm. It gives it a nice smooth feel. Your makeup goes on a lot nicer and things like that. That's why they're That's why they're a nice treatment, and they're not overly invasive. Nobody is going to ask Maggie when she leaves here, oh my gosh, what happened to you? Because there's not a lot of downtime here. If you get anything, it might be like a slight sunburn effect, which a little bit of mild hydrocortisone cream or moisturizer would take care of. The next step is we put this machine on aspiration, and that will take off a lot of the aluminum oxide crystals that we've already applied to her skin. Again, I'm going faster than I need to go. We can make this treatment as luxurious as you know, we'd like. And I usually like to ask the patient what it is that they are trying to attain by doing these treatments. And again, they will say either they have some fine lines and wrinkles that they're interested in removing, or they have some acne issues that they feel that it would help with their acne condition. Another thing is if you would have any kind of acne or skin problems like that, this treatment opens the pores and it helps the medications, whatever is, or your creams and lotions to absorb a lot better. So it acts as a lot of help in doing something like that also. With the price of cosmetics and everything else these days, I mean, any added help that you can get is nice. We can shut this off. And then sometimes, even though the aspiration is done, there's still a little bit of crystal here. And that's basically the treatment. I'll finish up with a little bit of moisturizer, and Maggie is good to go.